Hello, I'm Dr. Cameron Nejad, the founder of the worldwide Endomarch. I would like to welcome all of you to this virtual march and thank every single one of you for all of your efforts on behalf of women with endometriosis and also on behalf of all the patients who are involved or has had problem with coronavirus, and also avoiding getting involved and also avoiding in large groups to stay away from coronavirus as much as possible. This was a last minute program of the virtual Endomarch, as we have had a lot of questions from the members all around the world in respect to coronavirus and endometriosis. We thank all of you for accepting and postponing your marches around the world. We know how hard you worked during the whole year to have this program, and we respectfully ask you to postpone it, and you are very kind to accommodate the worldwide Endomarch. For this program, we have a group of our panel who have been with the worldwide Endomarch from the very beginning as part of the advisors and organizers. And one of them, who is the hero of the year for US this year, is Dr. Sandy Carson. She is going to be here and also address many of you who have had questions in respect to endometriosis and IVF and how your IVF should be proceeded or not proceeded during the coronavirus. Then we have Dr. Robert Voir, the past president of American Medical Association, who has been from the very beginning with the worldwide Endomarch for the past 7 years. And he is going to address questions you have in respect to the global issues of the coronavirus. Then we have Dr. Linda Judice, who is the head of the advisory of the worldwide Endomarch and the past president of American Society of Reproductive Medicine. She is there to address concerns you have in respect to endometriosis and also issues of the coronavirus. And we have Dr. Iris Gibbs, the head of the admission of the medical students at Stanford University Medical School, that she would address questions and I would discuss issues regarding coronavirus. And so please write your questions in the checkbox and send it to the Tiffany, who is managing the meeting, and she would bring up the questions one by one. Also, at this stage, also, I would like to really announce that we thank every center, every location, every country around the globe, more than 60 countries that they have been part of the worldwide Endomarch, and for your efforts to help other people in respect to coronavirus and also patients with endometriosis. I would not like to, the names are too many and too many numbers of centers and people, so please accept this as our sincere thanks to all of you for all of your efforts. And we'll start with a very short video from all of you across the globe. And after that, my brothers, Dr. Voir and Dr. Sina Nejad, and also my niece, Dr. Azi Nejad, also have prepared presentations and some issues that they would address it in coronavirus, and we will answer your questions one by one. And we like to congratulate at the same time Dr. Carson and Ms. Miramadi for the US and international Heroes of the Year for 2020 and for their significant contribution to help women around the globe. Dr. Carson has presently is the director of the IVF at Yale University. Her work has been, all of her career is to address women's issues, medical issues related to women, and we have already announced all of those achievements, some of them, not all of them, on the website of Worldwide Endomarch. The same is with Ms. Miramadi, who has been in Europe and has been doing a lot of help in Africa to help women and issues related to the healthcare of women. Saying that, we would like to go ahead and start with a 1-minute video about those of you across the globe who has sent us in respect to Worldwide Endomarch and why you want to increase the awareness about endometriosis and hopefully finding a cure and a method of prevention for it. Please go ahead and Tiffany and play the video. Please put the volume up if you can. This video has a volume and it is all from the Endomarches across the globe that they have sent us, because we have a lot of people have signed in. Probably the video is not, the sound is not showing, but that is, each one of those people are speaking up and say why they are doing Endomarch and why they are marching. The one that you are seeing is right now from Bulgaria, Dr. Bosep and Saveta, that they did it in Bulgaria.
December 2019, after a 20-year battle for a diagnosis. I Endomarch because in the north of the UK, there currently wasn't any endometriosis marches. I'm marching and I'm standing proud to stand and light up the whole of UK in yellow because there's not enough awareness. We get ignored. There's not enough endo specialists and we need your help.
Endomarch to us means to help create a healthcare policy to help patients like us manage the condition actually. Like COVID-19, let us all pray for a cure. It's time to end the silence.
So Dr. Sina Najat, please go ahead and you say something about the coronavirus.
Good morning, good afternoon, and good evening, all our colleagues, friends, and patients from around the world. I am Sina Najat from Atlanta, Georgia, and I have been very actively involved with the assessment and evaluation of the coronavirus and effect. I'm working with CDC and our hospital, and there are two important questions has been coming up in relationship to coronavirus and endometriosis. Number one question is, Tiffany, the question number one is, are the patients with endometriosis are at higher risk of acquiring coronavirus? And this is a very important question, although we do not have a specific answer related to the patients with endometriosis and coronavirus. We do know for the fact that the patients who have underlying medical conditions like diabetes, rheumatoid arthritis, lupus, conditions which weaken the immune system, they are at higher risk and they need to take extra precautions. How does it relate to the patients with endometriosis? It's the fact that patients with endometriosis depends on the extent of involvement, the effect on their different organs, the medications they are taking, this all could affect their immune system, their strength to fight the virus. So in that regard, it is recommended to take extra precaution. The second question, can you show the questions, please?
It's freezing everything when I pull it up, so I'm trying to.
Don't worry about it. I will address the second question, which is also very important, is patients with endometriosis who are taking medications, how could it affect their immunity or weakness on acquiring coronavirus disease? Certain medications definitely could interact with the immune system and the function of the organs in the body. For example, we do know as the fact that children and young adults who acquire viral disease such as chickenpox, they should not take aspirin, Motrin, or anti-inflammatory drugs because it could cause Reye syndrome. Reye syndrome is a condition that affects the amino acid metabolism in the liver. So these patients are at higher risk for liver failure. They are at higher risk for encephalopathy and conditions like that. So knowing the fact that anti-inflammatory medications are most common method of pain management in patients with endometriosis, it is better to avoid it, although CDC states there are no specific data on effect of the anti-inflammatory drugs and exacerbation of the coronavirus. It is recommended to avoid them if possible and use alternative pain management, or if you have fever, for fever management, use things like Tylenol. So these two questions I'd like to address it. And there is a CDC website that you can log in. They have all the information. There are panels. The last discussions was on Friday, yesterday, from 3 of the experts with all awareness about what to do to prevent it or protect yourself, and also the people with a weakened immune system, the medications to take. They have a very good detailed discussion about it. I will be available if you have any more questions, and thank you.
So now, the question is from Dr. Carson. Dr. Carson, how a lot of our patients with endometriosis, also they try to have children, and a lot of them undergoing infertility treatments, including IVF. And there has been many questions. What should be done and how should be dealt with?
Well, thank you. And thanks for inviting me to be part of this terrific panel. I really appreciate it. It's so difficult for patients with endometriosis right now who are planning on in vitro fertilization and even surgery to be done perhaps this month or next month, to put their plans on hold. But if you have endometriosis, then it's important that you realize that 1 or 2 months probably won't make a difference in terms of your fertility. And now, not being pregnant might be better for you and for the baby to delay that treatment. In fact, those of you with endometriosis probably are better prepared than any of us to deal with the coronavirus, because all of your life you've been dealing with a disease where oftentimes medical science doesn't have answers for you. And right now there's a lot about the coronavirus that we don't know. And we see our leaders making decisions with limited scientific evidence. And that's oftentimes what you've been doing throughout your life, because as rapidly as scientific answers are occurring now and being spread by electronic means such as this, the answers sometimes aren't quick enough for you to make a decision as to what you're going to do with your fertility or even with your pain. And you sometimes have to wait for what is in the scientific pipeline to make your decisions. And you see our leaders right now doing that all the time, what you've been doing throughout your life. And also, you've been making decisions of what you should do now without really knowing what is going to happen in your life. Will you be married? Will you want children? When will this pain end? And you're seeing many of our leaders trying to make the decisions that you've been making without knowing what to expect and what's going to happen. So having said that, we don't really have good evidence as to what the virus does during pregnancy to either the mother or baby. So far, there's no evidence that a pregnant woman will pass the virus to her baby. So that's good. And the recommendations by the American Society for Reproductive Medicine have been to avoid pregnancy because we don't know for sure what will happen. Now, last year, there were 34,000 deaths in the United States from the flu virus. And of those patients with the flu who became febrile, they had an increased risk in pregnancy of complications of pregnancy. Now, although we don't have similar numbers, thankfully, hopefully, they won't get that high of this virus, we do know that it does cause fever. And anytime a pregnant woman gets febrile, she is at risk for complications of pregnancy, such as preterm delivery. So that is why that most societies are recommending that women avoid pregnancy at this time. How long? Unclear. We don't know what's going to happen, but it probably is best to avoid pregnancy at this time, meaning putting your in vitro fertilization plans and your surgery plans on hold. And I know for those of you with pain who were looking forward to having surgery to relieve their pain, that means a month or so more of that. But right now, we're protecting our supplies and protecting the hospital and healthcare staff for patients who have severe life-threatening illnesses. And so you all are heroes out there for having to put your plans on hold for a couple months in saving those people. And we also have to tribute our leaders, such as the Najat family, who are willing to come out and support communications such as this, who can let us all talk together and together decide on a plan of what we should do.
Thank you very much, Dr. Carson. You are very kind. We appreciate it. And also, thank you for your wonderful comments about IVF and pregnancy. These are very, very useful. For the audience, if you have further questions, please sign in your checkbox and send the question further for Dr. Carson. There is also, there has been some questions from some of the patients with endometriosis that they have had endometriosis involving their chest and their other areas like kidneys. Dr. Farnejad, would you please address that if you may?
Unmute.
Dr. Farr, you need to unmute. There you go.
Sorry. Can you hear me now?
Yes.
Okay. Welcome. First of all, I want to mention in New York area, we have postponed presently all our elective surgical procedures, including patients with endometriosis. for several reasons. First of all, we in New York City hospitals swamped with the patients, so we want to keep all of our PPEs available for sick patients. And the hospital beds also encouraging patients to stay home as much as possible. So delaying the procedures for the women with endometriosis should not cause any problem. Even some of our cancer patients, we have decided to postpone them presently. So don't worry about postponing the surgeries. If you have questions, how to manage the pain or other related issues, we could address it. Certainly, any women or any men or anybody that has lung issues like asthma, COPD, and rarely endometriosis of the chest, these people are higher risk for the coronavirus, so they have to be more careful. And of course, majority of endometriosis patients are not postmenopausal, so they are younger women, so they should have a good immune system. And of course, older patients, if they have other issues, they have to be more careful. As Dr. Sinan Nejat mentioned, anybody that has some chronic disease, like chronic kidney disease, diabetes, etc., they have to be overcautious. Any other issue that you want me to address?
Yes, there is one question. There is one other question. There is one other question that they say that I assume you answered is that postponing the surgery. How long can I postpone my surgery? If it is some of the women that have not only endometriosis, but they have cancer, and you are an oncologist, if you can address that in more detail, we appreciate it. Endometriosis and also cancer.
Well, fortunately, endometriosis and cancer are not very common. In women, majority of the cancer are in postmenopausal, uterine cancer and ovarian cancer, and the cervical cancer, which is more common in younger women, unfortunately, the numbers are not very high. But overall, based on the type of the cancer, if the patient is a stable, early stage cancer and doesn't have any significant issue like bleeding, like pain, we could postpone them to at least a month. And even sometimes we could start medical therapy, like for example, for cancer of the uterus, endometrial cancer, we could put them on some kind of a hormonal treatment. And for ovarian cancer, sometimes you could give them chemotherapy safely to postpone the surgery for a few weeks. The same thing for women with endometriosis itself, that, for example, they have ovarian cyst, endometrioma, and there is a concern about the cyst and the possibility of being malignant. Those one also can be thoroughly evaluated by their physicians. And if there is no high suspicions for cancer, it can be safely postponed or put on some kind of hormonal suppressive therapy for a few weeks. And hopefully by the end of the April, the beginning of the May, we should be able to operate on them. But the best advice that I have, and this is what we have been doing, that one, we have been going case by case, evaluating every case individually based on her condition, based on her cancer and medical condition, and decide to operate or initiate medical therapy or not medical therapy and decide when to operate. And all the hospitals that we have been involved, they understand our position, and we almost every 2 or 3 days have telephone calls and making decisions.
Thank you very much, Dr. Farnejad. Now we have Dr. Robert Voir. He is the past president of American Medical Association. And I was wondering if Dr. Voir would like to address the global effect of the coronavirus and what is his opinion, and if he has anything to address regarding what precautions should people take, especially globally and for the travel arrangements, etc. Dr. Voir?
Well, thank you, Cameron, and welcome everyone to the 2020 virtual Endomarch. It's a great privilege and pleasure for me to participate in this 7th March of this great organization. As Dr. Najat has said, I've had the privilege of participating in every one of these since the beginning. I think it is a tremendous movement that was started by the Najat brothers, and I commend them for their great ingenuity and their persistence in getting this done. I'm a reproductive endocrinologist, like many of the other physicians here, taking care of infertility patients as well as women with hormonal disorders. And I've also had the opportunity to serve in a more global capacity as a member of the Board of Trustees of the American Medical Association, but also on the Board of Directors for the World Medical Association. I've also worked in the area of health information technology, and I give you all that as background to say that Cameron asked me to speak a little bit about coronavirus, even though the topic of the Endomarch is endometriosis. And so I think we've all seen the news. It'd be very hard for anybody who have, unless they've been under a rock or a cave, to not have heard something about the coronavirus. But let's be real clear about several things that I think are important messages to this audience. One is that this virus is different than other viruses in that it has not been seen in the human population before. And that's what makes it so very, very dangerous. Because the human population has not seen this virus, it is very, very virulent. In other words, it has the ability to spread very rapidly from human to human. It's also very problematic because it's spread through essentially respiratory droplets. So water droplets in the air can spread the virus. And that makes it very, very easy to hop from person to person. It doesn't require particularly close contact to move from one person to another. So those two features, the fact that it's spread easily through water droplets and that the human population has not seen this virus before, so there's no real immunity to it, means it moves through the human population very, very rapidly. And I don't want to be an alarmist, but I think we all have to recognize the magnitude of the problem. The number of people that have coronavirus in the world is doubling very, very quickly. And so the estimates are by the end of March, there'll be over 1 million people in the world that have coronavirus. I think we're well on the way to making that happen. There are estimates saying we could be at 1 billion people in the world with coronavirus in May or June. And that's a very staggering number to think about in this world. So we cannot underestimate the significance of the problem. And so that means all of the precautions that we are taking today in the various countries around the world are critically important, that we listen to our public health experts about what can we do to make this spread as low as possible. Because the other problem with the coronavirus is not only does it spread to people, but it appears to be quite potent in making people very, very sick. Not everybody gets sick with coronavirus to a high degree, but those that are vulnerable and those that are susceptible seem to get very, very ill, particularly in the respiratory. Your breathing is highly affected by the coronavirus. And I'll say also to this population, in the Endomarch, we have a lot of people that are fairly young. And there's been a lot of reports that coronavirus only affects the elderly. That is absolutely not true. We're seeing many examples of young people being severely affected, put in the intensive care unit, and even dying from the coronavirus. So there is no protection based on your age with coronavirus. So everybody needs to take precautions. And the other part of the precautions that are being put out there are not only to protect the individual, but it's to protect the entire population. Because of the susceptibility and the infectious nature of the disease, we have to put in place population things that affect the entire population, not just the individual. And so when you hear about these regulations or orders to stay at home and stay, social distancing and things like this, these are all things to protect the entire population. And so we as individuals must recognize that we have a responsibility to protect ourselves, but we also have a responsibility to protect the entire population. And so, again, while my specialty is reproductive endocrinology, and I know the topic today is about endometriosis and raising the awareness of the entire world about the 200 million plus women that suffer from this disease, many times silently and without recognition, we also have to recognize where we are right now in the world with the coronavirus infection. And I appreciate the opportunity to share this with you. I hope it's helpful for you. Happy to answer more questions. I'm working on a technology right now to put out a risk assessment tool that will also create a two-way link of communication between individuals in the public and public health organizations. So the public can get a reliable, curated stream of good information from public health officials, but public health officials can also get information about the health and life status of the public so that we have a better way of dealing with the changes that are happening as this coronavirus infection spreads around the world. But thank you, Dr. Najat, and your brothers and rest of your family for doing this for all of our patients that suffer from endometriosis, and I hope we'll be able to help many of you in the future, if not right away. Thank you.
Thank you very much, Dr. Voir, for your dedication to the public service and for all what you have done and what you are doing for the benefit of the mankind. We appreciate it. There are some questions from Dr. Linda Judis, past president of American Society of Reproductive Medicine and also a prominent researcher about endometriosis. I was wondering if Dr. Judis would like to address if there is any research being done in relationship to coronavirus that she would like to share, and also if she has anything to add in respect to the patient with endometriosis and coronavirus. Dr. Judis?
Thank you, and welcome everyone to the 7th annual Endomarch. I have also been there from the beginning and am deeply aware of all who are affected around the world by this still somewhat enigmatic disease. Before I go into answering the question specifically, I wanted just to make a couple of comments. First, with regard to the coronavirus, what others before me have mentioned is extremely important in terms of getting accurate information. If one wants to look for guidelines about getting pregnant or not getting pregnant, going to, if you're in the United States, the American College of OBGYN website, there are guidelines there. And I currently am the president of the International Federation of Fertility Societies, IFFS, and we have posted guidelines from nearly all the professional organizations around the globe, including those from the World Health Organization, with whom we are an NGO or a non-state actor. So getting accurate information is extremely important. Also, with regard to, and sometimes this is a question for not only women with endometriosis, but many patients who now have symptoms that they feel they need to be, that would warrant a visit to their physician. Almost the whole healthcare system, at least in the US, is really going to telehealth. So it doesn't mean that you won't get attention to what's going on, but rather the discussion will be face-to-face, much like this is, with your healthcare team, so that your specific issues can be addressed. And sometimes women do have to go to radiology to get an ultrasound, or they may have to go to the emergency department. And so those are things that, you know, the whole world won't stop, hopefully, because of COVID-19. So taking care of oneself is extremely important, and those around us, those whom we love, and friends and colleagues. So with regard to research, there are several areas. One is clinical research, focused mainly on endometriosis. And I think we have seen a number of pharmaceutical companies now that have been pursuing some treatments for endometriosis, such as Orilissa, which came out almost 2 years ago and was FDA approved. And there are others currently that are under investigation, and I think we'll be hearing more and more about. They're all sort of variations on the theme of the GnRH analogs, much like Orilissa is. But there are other things going on as well. And the importance of designing a clinical trial appropriately cannot be underestimated, because sometimes we get negative results and we say, oh, this didn't work. But then when you really drill down into the study design, it may not have been optimal. In the laboratory, certainly, I know our team is working on the immune system in the endometrium as well as in the peripheral circulation. So this is an inflammatory disorder, endometriosis, and women who have endometriosis tend to have a heightened inflammatory status, if you will. Now, with regard to, does this impact susceptibility to COVID-19? We don't know. But again, the precautionary principle is really something that leads the way here, and that is to, you know, good hand washing, social distancing, self-isolation if you need to, if you're in a special category. And there was a comment about disease in the chest. So some women have pleural endometriosis. And my advice is certainly to take extreme caution because of the essentially higher risk, although we don't know, but just from what we know about the physiology of that disorder, we would think that women who have pleural or chest disease need to be extremely careful. So lots going on, and hopefully everyone around the globe will be able to get the care they need as we go through this pandemic, which hopefully will have an end in sight soon. Thank you.
Thank you very much, Dr. Judith, and to you, Dr. Voir and Dr. Carson. All of you have been involved with the Worldwide Endomarch for the past 7 years, and we thank you for your comments. Now we have Dr. Iris Skip. She is the head of the Dean of the Admission for Medical Students at the Stanford University Medical School. And I was wondering, Dr. Gibbs, what is your advice for younger patients with endometriosis. Many of them are students and teaching medical students and other students in that age group. Or if you would like to address anything in this regard, we would appreciate your comments. And there are some questions again from the students. And so you will address Dr. Gibbs.
Cameron, thank you so much. Really appreciate this opportunity. Thank you for inviting me here today. So I've been a long time colleague of Dr. Najat, and I've been a friend of the Endomarch as well. I'm also a cancer doctor. I'm a radiation oncologist, and I practice at Stanford Medicine, as well as being, as he mentioned, the Associate Dean for Admissions for the medical school. One of the things I can mention now is that as a radiation oncologist during this time, one of the things that we have done is to make sure that we really protect our patients. And we do that mainly by, as other physicians on the panel have mentioned, by really focusing mainly on the most urgent medical conditions at the current time, and also being able to connect with our patients through video visits and telehealth. And that's one of the ways that we are protecting our patients. That in that way, we also preserve PPE as well. We're protecting ourselves as well, so that if there is a surge, then and we are called to the front lines, we as physicians would be able to do so. And so as the Dean of Admissions, one of the things that I think that students in particular, I come into contact with students worldwide. Indeed, yesterday I completed, during this time when we're doing everything virtually, we actually did an entire virtual recruitment fair where we field questions like this from students. But one of the biggest questions that people have, because I think people who are drawn to these areas of medicine, it's sometimes antithetical to just stay still. And so they want to be doing things, they want to be able to help. And so my first message is that the first thing that you can do to help others is to abide by the national recommendations of social distancing and sheltering in place, because this is going to be one of the most important mitigating factors in terms of spread of this particular virus. But I know that in that there are other things that we can do as well. Some of the things that we can do is advocacy in terms of reaching out and providing support for individuals and people in and around your area. And so that's why I think for me, the Endomarch is a really important example of the things that I like to see when I'm even evaluating candidates for medical school. And that is, being able to not only approach issues from an academic perspective alone, but then to extend that in a way of committing to advocacy. And individuals who I think can showcase this level of advocacy, just as the Endomarch has been a wonderful example of, and being involved in this kind of advocacy to support patients and support individuals. I think it's not lost on me that this is the end of the Women's History Month. And this one's a great opportunity to be able to dispense educational information and to support individuals who are going through these kinds of conditions. Some of the things that I've talked to some students about in terms of how they can be advocates during this time. Right now, we know that a lot of the teaching that's happening around the country is being done remotely, and our teachers still require a lot of support. And many of our young folks really actually have a lot of technical skills. And so being able to sort of partner even virtually with teachers as they're helping to teach their classes. Many of our students have a wealth of knowledge around a great deal of topics as well. So I think you can still continue to be advocates during this time and to support others, even if we have to do this sort of distantly and in a social distancing sort of way. So I'm here to support, and I want to also congratulate the Worldwide Endomarch for really a wonderful opportunity to be able to serve. Thank you.
Thank you very much, Dr. Gibbs. I would like to also thank Dr. Gibbs because practically we put this program together yesterday. All of my dear friends and colleagues know I just texted them yesterday, and last night when Dr. Gibbs called me, I said, well, let's talk about this, and we put it together. So I apologize to all of our friends, all of our colleagues, that for some reason we didn't let them know because this was done yesterday. Please forgive us. And we thought there were too many questions, a lot of questions, we decided to address that. So thank you, Dr. Gibbs.
Yeah, Cameron, I think that one's so, thank you very much. I think originally when this one was supposed to be a physical event, I was going to be out of town. And so this one gives me an opportunity to be able to be here with you all. So thank you.
Of course. Now, a lot of you are home with your husband, with your children, and you have questions, especially if you have younger children and they are in higher school or in a school, and you want you have some questions in this respect. Dr. Azadeh, our niece, who has a 10-year-old daughter, and she would like to hopefully address this issue. How should the students and the mothers, parents, how do they deal with in relation to coronavirus? Dr. Aziz, would you please address this question?
Yes, basically, we're here in California, we're doing the same thing as majority of the different states are doing, shelter in place. We spend most of our time at home doing homework and trying to be careful about not being exposed or exposing other people. So basically that's what we do here, as everybody else is doing. We don't go out, we spend more time. So it's been a challenging and fun for some of us who don't get a chance to spend time with their children while we're working. So it's been all right. Sorry.
Well, thank you so much. We appreciate it. Thank you, Dr. Aziz. So, if Dr. Sinanejad, would you like to say anything?
Yes, sir. May I interrupt? Dr. Azadeh, I understand you are a professional, you are a doctor, you still have to take care of your patients. At the same time, you have to take care of your family. So for all of us that we are involved and we have to be available, how do you manage to keep a balance between taking care of your patients, taking care of your family, and stay safe?
Yeah. During this time, it's been, we're learning how to do a lot of things remotely. Sorry, I get.
So
I got interrupted, sorry. Yeah, basically what we do, I apologize. Basically, mainly we do telemedicine and, get online, answering patients' questions. We, if there are cases that we need to see the patient, we go to office individually and assess the patients. But majority of the time we are available during like regular hours and even after hours, answering patients' questions and trying to address their problems, balancing that with the having children at home, or having, for example, for me, my daughter at home, we have a set time to spend time, do work, school work. So it's taken a while. You know, the first week everybody was at home and the kids were looking at it as a vacation, but after the second time, school system has, you know, addressed a lot of these things, and everybody's doing online classes, and so it is not always easy to balance it, but we're learning. So just like everything else, we're getting used to staying at home and practicing social distancing. It's something that it requires practice, and we're doing it. So just like everybody else.
Thank you.
Thank you very much, Dr. Ozzy. There is one question, and I would encourage Tiffany if there is any specific question to address. But before that, I would ask Dr. Wharton in Michigan if there is anything specific, if he would like to address about Detroit, Michigan, and after that, Dr. Chuck Miller, perhaps if he is online and he wants to say something about Chicago. As we understand, Chicago might be the next hot spot. If they are online and if they want to address it, I appreciate it. Then there are many questions coming from the public that Tiffany would address it from the panel one by one. Is Dr. Wharton there? Or?
Professor Alan Ducherney, Dr. Charles Miller, I see them, they are online. And
if Dr. Ducherney that would be fantastic. If Dr. Ducherney, you have been with Worldwide Endomarch from the past 7 years, and we put this together very last night. I personally apologize to you not to contact you. it was too late, and I didn't want, when I contacted other people, it was very late in the West Coast, and I was hoping that you are on the line. If you are online, it would be a privilege to hear from you in respect to NIH and your thought process in respect to coronavirus, or any advice you have for anybody.
Okay, I am online. I did get the message early this morning. You know me better. You can tell me anytime at night. I'll be available. So I'm happy to be here, and it's great that you're doing this. I just want to give a little portrait of the government and how the government is involved. You can see I'm still working. I go in every morning because we still have patients in the hospital. Those patients are there because they're critically ill, or if they're part of a protocol. Part of our mandate is that if a patient is part of an expensive protocol, you can't interrupt the protocol because of this. I also have to say that usually before I speak, I have to get clearance from the government, but obviously I can't do it this time. So anything I say is part of my impression, and I'm not representing the government. It seems to me that in Washington, at least, we don't seem to have we don't have a lack of abundance of equipment to take care of patients. At the NIH, we've set off a ward of 40 beds for patients that are ill. We haven't even had to open that yet. We do have a small unit where the Ebola patients were kept, and that is open and has a few patients in it. To my knowledge, they're not critically ill. As far as the rest of the NIH, we're locked down like everybody else. We can only see emergency patients. We stopped our fertility preservation program. We stopped our ovulation induction program. We started treating patients. We stopped treating patients with chronic diseases that can wait. obviously the big question for all of us, when will this end? There's no good evidence that it will end soon. There is lots of work done on the vaccine. We have 2 groups working on the vaccine. I think there's a group in Atlanta working on the vaccine, and there's plenty of places around the world working on a good vaccine that won't be available for a year. So that's one area of research. The other area of research is trying different medications. You've heard about quinine from the president and his team. There is a drug that was used in the Ebola epidemic, and that's being explored. So the government is involved in this. We're on high alert as far as that's concerned. Obviously, our research agenda is trying to be addressed as best we can. And of course, an applause for Dr. Fauci, who's the head of the Infectious Disease Institute, who has been president most of the president's press conferences, and is kind of the word of realism as far as this is concerned. So I'm as frustrated as everybody else, but it's a historic time for all of us. I know that we'll get rid of it, we'll move on, and I think it's great that we've come this far as telecommunication is concerned, because we're not as isolated as we would like. And I urge everybody at this time to reach out to their friends and talk to them, so everybody knows that we're not isolated. So thank you for asking me to comment, and thanks for doing this.
Thank you very much, Alan. Dr. Duchesne, to my brothers and I, is like our older brother and our mentor. He has been, we have the world respect for him, and I really appreciate you. And I'm so happy, Alan, finally my younger brothers, they did something and they contacted you because I'm happy that you were on my mind. Great. So Tiffany, would you like to ask question? Is there any question that Dr. Duchesne could answer, because he is right at the center of it at the National Institute of Health in Washington? And please ask the questions from the panel, Tiffany.
Sure, absolutely. We actually have a lot of questions coming in. So to directly address the COVID-19 and what we've been talking about, a question just came up. Is there a true relation between the COVID-19 and the NSAIDs and how they affect it? Is there anything, a lot of the endometriosis patients are on medication that they take daily that have NSAIDs or, the Motrin and things like that for pain. And you're seeing all these things about how it could directly affect it. Is there truth to that? And is this something that they should be worried about?
May I address that question?
Of course.
Yes. First, I would like to let you know, Dr. Charles Miller, also from Chicago, he was or is online, and he will address his area. But going back to the question of medications in general, and specifically anti-inflammatory medication like ibuprofen or aspirin, how could it affect the patients with endometriosis in relationship to coronavirus? I covered this in the beginning, and I will repeat it, that we do not have a specific data on corona and anti-inflammatory medication, but we do know for the fact from the studies on the children and the young adults in relationship when I have a viral infection, specifically chickenpox, influenza, they have fever or headaches or aches, it is better not to take aspirin or anti-inflammatory medication because it could cause the metabolism of a specific amino acids in the liver, could cause liver failure, could cause encephalopathy, could cause death. They call it Reich syndrome. Now, having said that, there are some patients like severe rheumatoid arthritis that there are some anti-inflammatory medications they have to take it. So at this point, it is better for pain management that avoid anti-inflammatory medication. If possible, use things like Tylenol and other medications who do not have this specific effect. Do we have data on it? No. What does CDC recommend? The same thing as I mentioned it. No data available, better to avoid it if you can. Now, having answered that question, I see Dr. Charles Miller is online. Dr. Cameron, if you'd like to introduce him.
Yes, Dr. Charles Miller is the reflective endocrinologist as well in Chicago, and he worked very, very hard to organize one of the largest worldwide Endomarch programs in Chicago for this year. And unfortunately, due to the coronavirus, and they went through significant amount of cost, they had to cancel it. So I appreciated he is on the line and he could address the issue of the coronavirus. As we understand, Chicago is going to be the next hot spot after the New York and Los Angeles. So, Dr. Miller?
I think, Tiffany, you have Dr. Miller on mute.
I don't. Dr. Miller, you need to enable your audio. For some reason, there's no audio on your end. Maybe while he, oh, there we go.
Can you hear me?
Dr. Miller, there you are. We got you.
Okay. Well, good morning, good afternoon, good evening to everyone. First off, I again commend you, Cameron. You never cease to amaze me. The family Najat, we had such difficult calls a couple weeks ago when we were deciding to cancel the Endomarch around the world. Obviously, that was a very good decision given the state of affairs and the spread of this terrible, terrible virus. I also want to congratulate Dr. Sandy Carson. Those of you, I have to tell this story. There always has to be fun. There always has to be laughter. Sandy and I were the first two medical students to walk into the brand new Prentice Women Hospital in Chicago in 1975 when it was opened. And now we're on the second generation of the hospital. Our hospital that was brand new, and we did our junior electives in and senior electives, is now closed. Just a story. Happened to be on the panel with Dr. Judice, Dr. Jaterney, two of the absolute great scientists of our field. And I feel very, very proud to be part of this. Chicago, as Cameron said, is in a lockdown like many other places, but we have the unfortunate label of being the next hotspot along with Detroit. Our hospitals are gearing up. Hopefully we'll not have the numbers that we're seeing in New York. It is interesting, the suburbs that I live in are amongst the most problematic right now in terms of number of cases. We certainly, as someone who practices reproductive medicine and also surgery, I've seen a great impact on my practice, on our patients. I had 8 surgeries canceled this past week. We're in a lockdown in terms of IVF cases. There is some hope, however. last night, nearly 1,500 physicians and healthcare workers were on a call to discuss what we should do, if ASRM guidelines should be released somewhat from those in real need. I do anticipate that there are concerns. I mean, many patients we operated on for endometriosis, ovarian endometriomas, prep them to have their cycles go, and now are put at bay. Women who have had extensive endometriosis surgery, ovarian surgery, and have impact on their ovarian reserve are being held at bay. Patients, we know Illinois, for example, is a mandated state. And as a result, insurance covers many of our IVF cases. Are now, unfortunately, many people will be unemployed and lose that insurance. So many of us are stressing to ASRM, there must be some ability to talk with our patients, and in those cases when we deem it important, and that means some endometriosis cases, not every case, but many endometriosis cases where we need to move ahead. We must have the opportunity to dialogue with our patients, to do all the things right in terms of social distancing, in terms of using a protective gear, in terms of washing surfaces, et cetera, et cetera, et cetera. But we must be able to dialogue with our patients. We cannot forget about the case that endometriosis is a real disease. It doesn't go away. It doesn't go away. And neither does the issue of infertility. And when those lines are crossed and the need is there, I believe we need to have the opportunity to dialogue with our patients, point out the risk, the benefits, and then have the opportunities to be doctors and nurses and take care of our patients. So that's my soapbox. I hope some of you agree. Thank you again, Najat, especially you, Cameron. You never cease to amaze me, my friend.
Thank you very much, Chuck. You're very kind. Thank you. Thank you for your wonderful comment. Dr. You mentioned Detroit, Michigan, and now Dr. Kurt Wharton in Michigan, in Detroit. He is going to say points about Michigan. And again, we apologize to everybody. And one of the areas that was impacted again by postponing the Endomarch was Michigan. Just like Dr. Miller, Dr. Wharton had gone through a lot of hard work with people like Marian Smith and others to make that successful. And I know it cost a lot of, not only time, a lot of money for everybody's, but you understand that that was really to the benefit of everybody else to postpone these activities. And Dr. Wharton, would you like to mention and say anything about Detroit?
Dr. Cameron, I don't see Dr. Wharton, but I do see some questions from the panel, from the audience. One of them got my attention, and Tiffany would go through the other question. One is, women with endometriosis who are pregnant, are they at higher risk? Women who are pregnant also have a specific care they have to take. Pregnancy itself could affect the immune system, but not in general. I wouldn't say women with endometriosis who are pregnant, they are at higher risk. But of course, they are taking care of two patients at the same time. So the more precautions they take, the better. Back to you and Tiffany.
Okay, Tiffany, please ask the next question.
Okay, great. We have a lot of great questions coming in, and I just want to take a second to thank all of the panelists. Again, everyone is so happy to have all of you. We're so lucky to have all of you on here, so we really appreciate it. As someone with endometriosis myself, I'm very happy to be here with all of you, and the audience is loving every single answer that you're all giving, so thank you very much. So we have lots and lots of questions coming through. But one question that came through a few times is, if someone has endometriosis, how much is it hereditary in the family? How at risk would her daughter be? She said that she was diagnosed when she was younger and hasn't really had any symptoms. She had a surgery before she had children and hasn't really had any symptoms, and now has a teenage daughter that she believes, you know, may possibly have it. And what's the risk of your daughter, or, you know, in the family, hereditary, what's the risk?
Of the panel, whoever wants to address it, please go ahead.
I can start. This is Linda Giudice. So we think that about half of endometriosis has a genetic basis and about half an environmental basis. Doesn't necessarily mean chemicals. It could be stress. It could be other things. However, with regard to genetics, there's not an endometriosis gene, for instance, that has been discovered. There has been a huge amount of genetic analysis in thousands and tens of thousands of patients across the globe, and this is all through the International Endometriosis Genome Consortium, IEGC. Dr. Najat is part of that, Dr. Cameron, and our group as well. And what's been done is that certain parts across the genome have been identified as being hotspots, if you will, for associations with endometriosis. Those areas, so-called loci, have many genes in them. But some of the genes have to do with estrogen action and metabolism and FSH, and other areas of the genome that don't even code for proteins, so regulatory areas. So there's no one gene. You can't go in and get a test for endometriosis per se, a genetic test. And however, we do think that endometriosis is a complex, multifactorial disorder. In terms of what's the risk for a daughter, I think it's important, and we don't have numbers that we can give you. We can't say there's a 10% risk or a 30% risk. However, and also we do not really have good data for prevention. So going on birth control pills continuously to suppress any menstruation is not something that we can actually recommend, because there are no data to support that. That said, I think being very aware, and I think this is one of the great things about the Endomarch, is bringing the awareness of endometriosis, not only to adult women, but also about the incidence of the disease in teenagers. So many teenagers are dismissed as, you know, they have cramps, they miss school, they're dismissed as trying to get out of going to school. Not at all. These are real symptoms that need to be addressed. So if a woman is worried, has endometriosis, and she's worried that her daughter may develop it, I think the most thing we can do right now is minimize exposures to estrogen-like compounds. Certain makeups have them. You can go to the Environmental Working Group website, EWG, to look for different cosmetics and personal care products to minimize. And also to be very vigilant about symptoms, so that if a young woman has severe cramps, she does need to be treated, whether it's medically or surgically, and that's really, really important to do.
Thank you very much, Dr. Giudice. We have many questions, a lot of questions also specifically about endometriosis with this very distinguished panel. Also, I would like to let you know that others, we have Dr. Antonio Gorgillo and Dr. Louise King from Harvard, that they are online, and I'd like to thank them. Their Endomarch was influenced again by postponing it because they had worked very, very hard to make it a very successful program, and I thank them. And so if there are questions for Dr. Gorgillo and Dr. King, also Dr. Wharton, hopefully when he joins. So Tiffany, ask next question, and the panel will answer it. Hopefully Dr. Gorgillo could answer it if he is available.
Great. So we have a lot of questions coming through regarding IVF and fertility. So I'm going to just kind of put them all together and ask a few questions in a row that maybe anyone on the panel would be happy to answer. The first question is regarding egg quality and quantity and what effect that may have on fertility, and if egg quality may increase the risk of not having a healthy baby or increase risk of birth defects.
Perhaps Dr. Carson, you would like, or Dr. Gorgillo? Okay, no problem.
It's not by the way, thank you very much for inviting Cameron. Thanks for the salute to the rescheduled Boston Endomarch, which I hope will still go on sometime later this year or maybe next year. But so the question is not the clearest question, honestly, in terms of having a clear answer from me. I think the person that has asked the question, if I get it right, is asking whether the number of eggs in terms of low number has a direct effect on the general success of IVF. And yes, there is an impact in terms of success of IVF. Which of course is mostly impacted by the age of the patient. So, you know, I would not exaggerate if I were to say that if you get 4 eggs from a 30-year-old, you're probably in much better shape than if you get 20 eggs from a 42-year-old. I think that nobody would be in disagreement with that. So age is definitely the main factor, but there is no question that that the number of oocytes can affect within each age range the success of IVF. By its nature, IVF has a tremendous attrition at every step, in that not every egg is normal or mature, and not every mature egg can fertilize. Not every fertilized egg, i.e. embryo, will develop to a stage where it can be transferred, and not every developed embryo is euploid, which then goes back to the incidence of euploidy by age. So that is not all the embryos are chromosomally normal. So the question, I think, in endometriosis and IVF, of course, the focal question to us is the management of ovarian endometriosis in the setting of a patient who is destined to go to IVF, which is already different from the management of endometriosis outside of the setting of IVF. In the setting of IVF, we've been discussing this for many years, and in fact, a lot of the important literature comes from our colleagues in Milan, to whom we have to give a salute in this incredibly hard days for the city and for the whole north of Italy. But anyway, the impact of endometrioma treatment in IVF in general at this point is considered as a impact that will not improve embryo quality, and it might decrease the number of eggs that you are able to retrieve. And that's why if there is a true indication for addressing endometrioma in a woman that's about to undergo IVF, this has to be planned very well in terms of how the surgery is to be executed, when it has to be executed. Does it make sense to retrieve eggs before the surgery and so on. It's, of course, this is something that in almost every annual meeting at the AAGL and ASRM, as you well know, we have full sessions dedicated to this where experts debate the best treatment. So giving a quick answer is difficult, but hopefully I've been able to elucidate just the very basic of this. I don't know if there is a follow-up question on that, or if any of my distinct colleagues want to, in fact, ampliate on this.
Thank you very much. One of the follow-up questions to that have come through a few times today, they're wondering if patients should hold off on trying to get pregnant currently with what's going on with the pandemic.
But perhaps Dr. DeCherney could address that. Or Dr. Carson. I think Dr. Carson addressed it. Yeah, go ahead.
Sorry, it takes a couple seconds to not unmute. I think that it's important to realize that we don't know the effects on pregnancy or pregnant women and babies with this virus. It looks like it's encouraging, and for women who are currently pregnant, it looks as if we can say that if they keep their fever down, that maybe there won't be any harmful effects compared to others with a virus. But we don't know. And so if women have an opportunity to delay pregnancy, that is probably the best course of action right now. And how long? We all have to wait and see. But for now, certainly delaying pregnancy for a month is probably the best idea.
Can I make a comment?
Sure.
Can you hear me? Yes. There's a small series out of China of 33 women who were affected with the disease, and 4 babies tested positive. 3 babies were retested and within a week had no viral titer. So that is somewhat promising, but that is early studies. But that does not address the symptoms, as Dr. Carson had talked about, and the febrile illness that can have morbidity.
Dr. DeCherney is also back online.
Well, I agree with what's been said. I know about the Chinese study, and I think that that's helpful. It's always safe at this time, and we know so little about something, to tell patients to wait to get pregnant. But if this lasts a long time, then we would have to reevaluate things. Obviously, no matter what happens, with these large numbers of patients being affected, there will be some adverse outcome to pregnancy. That's not to scare patients that are already pregnant, but we just know in population studies, when you have this many people affected with something, and it might not even be associated with the virus itself, it would be hard to take that out of context. But I think for the time being, I think the best advice is to wait.
Thank you very much for all of your answers. Any words of advice for those that are currently pregnant right now with the pandemic?
I think that it's important, again, to stay away from, again, practice social distancing, stay away from large groups, wash your hands frequently, and take all of the precautions that are being recommended. And if you get a fever, call your obstetrician gynecologist, or the other person, your provider, I should say. Call them first, call the office, and do it as soon as you become symptomatic, as soon as you have a fever, call them first for some advice.
And what advice should the obstetrician give that patient?
I think it depends on their symptoms, and it depends on what's happening with the pregnancy. And that's why we can't generalize right now. That's why it's important to call. Don't go into the office, but give them a call and see. Depends on the fever, how high the temperature is, whether there's cramping, any bleeding. And the advice should be personalized.
One thing we are doing at our hospital, we have a large number of deliveries, which we are practicing, and we do not allow any visitors at the time of delivery, which is very important. The extreme cautions are taken. Now, normally the family members would like to be present at the time of delivery, but it is very important to minimize contacts with the individual around. And at the time of the delivery, the least number of people who are essential should be present in the delivery room.
Can I make a comment? In New York, that is a very good point. Actually, patients that they have to go to the doctor's office, it is recommended that if they go with their husband or friends, they stay in the car and even do not go to the office of the physician, and they go by themselves. And the shortest time that they could stay in the office is the better. And as Dr. Sinan Nejat said, when you go to the hospital, they have only one person could stay with them. And some of the patients, they may get upset and decide to go to another hospital. This is not a very good idea to do that one, to try to find another hospital to accept more visitors. You don't want to change your physician in the middle of your perinatal care.
Thank you very much. So, and I also like to, during this time, thank the many other people that, like Tiffany and also Barbara Page, Zoe, and Genesis, all of them that are, Melanie, and also everyone that they are trying to answer these questions, bring it up. The headquarters of the Worldwide Endomarch, that yesterday they were scrambling to put this together. So Tiffany, what are the other questions?
So another question that keeps popping up that I think is really important right now, in our endometriosis community, we've seen a lot, especially in the past year, of discussion around dealing with mental health and chronic illness. And currently, right now, what we're going through with this pandemic, what would suggestions be, or do any of the doctors have any advice for, you know, the chronic illness community during this time to kind of handle the mental health aspect of it?
Dr. Voir, because you have a global view, would you like to address that? I don't know.
I think they stepped off.
Okay. Well, on the panel, anybody would like to address that issue? Dr. Dishani, perhaps?
This is Iris Gibbs. I just wanted to say that a number of our hospitals have enhanced their support from providers who provide mental health support, and I would certainly reach out to the local hospitals, not directly by going, but each usually will have something posted as a resource during this time, because we know that this one's a really important part of this this crisis, because everyone is dealing with a fair amount of stress due to you know, the coronavirus, and on top of that, with other chronic illnesses, it only compounds things. So Each of our hospitals will generally have that. And if I can find it for our region, I will post it.
Also, I would like to add that I would say easily mental health is one of the areas where the physical distancing is going to impact less. I think all of our counselors are very active these days. They're mostly on telemedicine on the phone for now. And then as soon as our hospitals will define something that they think it's HIPAA compliant for them, they will also allow a video service to go on. I know that the local counselor services in Boston, many of them are already doing video counseling. I mean, in the end, I think surgeons are the ones that are very impacted in their work because we need to examine our patients. But a very profound talk can happen between the mental healthcare person and the patient. I think with basically no difference than if they were there in person. I think the physical distancing there has minimal or no impact.
I also would like to add two areas. One, Tiffany, would you please see if you could put the last slide on, which has a lot of resources provided by CDC?
I actually copy and pasted it into the chat as well, which I'll paste again with all of the information that was in there. So any of our registrants could click right on the link right in the chat panel. But I will bring that screen up. Just hang on. You can keep talking while I pull it up.
Okay. I'd like everybody to know there is a Corona hotline. Remember, Corona by itself, although it is a viral disease, it could have social, financial impact on the people's conditions. Therefore, they may not have the Corona disease, but they are stressed. There is, CDC provides these sites. Please refer to it. Also, there is a call center 24 hours a day. At the top, you can see it. Please refer to these sites, take advantage of it. And anybody, any form of stress should seek help. As a healthcare provider, I know all of physicians, we are available 24 hours by cell phone, by answering service, and we can address any question physically, mentally, to take care of you at any time.
Thank you very much. This is great information. I will copy and paste it and put it in the chat for everyone as well, just in case you want to copy and paste it on your end, or if you'd like to just click directly from the chat, you'll be able to do that.
Thank you.
Of course.
One comment that I see on the chat about patients with endometriosis, how could they improve their condition? Two aspects. If you are taking any kind of the hormonal treatment like birth control, progesterone, or ELISA, or Lupron, whatever it is, and it is safe to continue it at the present time for next few weeks or few months with consultation with your physician. I am sure they will be more than happy to give you information and guidance. The important other thing is we all have to accept that we are in a very unusual situation, like we are in a war. And the way that in New York, I advise my friends and some of my patients that we all have to assume that we have coronavirus in our body. So it has two aspects. One, ourselves. The other aspect is others. Regarding ourselves, because majority of the coronavirus infected people do not have any symptoms. So we have to be careful that we don't have any symptoms. And if the symptoms are mild, like mild cold, we try to manage it that way and try not to go to the emergency room because we are going to swamp the emergency room. And if the symptom gets worse, like a respiratory issue, high fever, severe fatigue, then you have to call your physician and then decide to go to the emergency room. Regarding other people, definitely minimize going outside as much as possible and use masks, gloves, and keep your social distances as you mentioned. The other important things at your home, be positive. Listening to news constantly, it is going to make you depressed. Some of the patients with cancer patients, some of the patients with endometriosis, already we are under the stress, financially, family-wise. So try to find physically and mentally something to cheer you up. Always be positive. Good book, funny movies. It is better than constantly watching the news and repeating the same thing. So that way, besides reaching to hospitals that they're offering psychological support, in your home, your environment, also try to help yourself and your family and your friends. It's a good opportunity that friends that you have not talked to them for a while, or family, to reach them. We all around the world, it is not even around New York City, around the world, we are all together, and that way we will overcome of this situation, but we have to keep our spirit up.
Thank you very much. That's really great information that we definitely all need to hear right now. We have a few more questions. One question that has come through a lot that I think really should be addressed. Yes?
Can I make one comment?
Of course.
I think that one of my concerns, am I coming up? This is Dr. Chuck Miller. One of my concerns is we don't know when there's going to be a time, just because of the concerns about elective surgery and what is deemed elective surgery by people making decisions within the surgical armamentarium. People may want to talk with their physicians about medical treatment who are not actively involved with medical treatment, just to help during the time that they are not able to proceed with surgery, since we really don't have a specific timeline. Most physicians, or many physician groups, are doing teleconferencing. I spent this morning before the meeting doing teleconferencing with my patients. And this is one of the questions that people are coming back to me with. So I think it is important to have that kind of dialogue with your physician provider, your healthcare provider, particularly if you are not on a medical regimen had been scheduled for surgery, and we don't know when we're going to be back in the OR again.
I have to second this, Chuck. It's very important to talk about this because we all know that there are some buzzwords around that our patients really, really don't want to hear, and one of them is exactly that. Different levels of medical treatment instead of an effective excision surgery. But this is unfortunately a very unusual time where I have to absolutely agree that this is a time where we have to find the courage as patients and providers to maybe go into temporary treatment with medications that maybe we would have snubbed a little bit if we had access to an operating room. But the reality is that some of our hospitals are really going to be transformed into war zone hospitals for not weeks, unfortunately. And I really cannot start to understand how else we could manage some of our patients that have real problems with pain without some solid medical treatment offered, even if it's not our style, even if patients specifically come to us because they know that we will not just park them on these medications and we will take care of them in the operating room. This is unfortunately a time where part of our armamentarium is cut off. And the sooner we realize that, the sooner we find the courage to talk to our patients exactly in the way that you are indicating, that the better the patients will be, I think.
Buddy.
That was some really great advice. Thank you very much. Dr. Cameron, you're muted. I'm going to unmute you because I think you're trying to talk.
Yes. I would like to thank everybody. We had planned this originally for only 1 hour. As you can see, it is almost 2 hours and still there are questions coming in. But for the benefit of everybody else's time and considering everybody else's time, I would like to thank all the panel. I would like to thank all the participants, and I would like especially all the people around the world who tuned in and listened at these trying times. Also, I would like to thank the organizers who have been working very hard, Barbara Page, Tiffany, Zoe, Genesis, Elisa, Viri, and everybody else who has been on this trying to organize this, and we appreciate it. And I wish you health and goodness. Please stay healthy, everybody. And we say goodbye and thanks again.
Thanks.
Bye.
Thank you. Bye.
Have a nice
Thank you, everyone. Stay
Bye-bye.
safe.
Be safe.
Be safe.
Bye.
Thank you so
Bye-bye.
much, everyone. Be safe.
Thank you,
Be sure
Tiffany.
to check out the Facebook page for more information and for the replay of the video. Thanks, everyone. Bye-bye.
Michaela, thank you.